Hello and welcome to Pace Hospital's podcast. Today, we are diving into an essential topic that offers deep insights into your metabolic health, that is, the fasting blood insulin test. Often overlooked during routine checkups, this simple test can reveal much more than just your sugar levels. Helps to detect insulin resistance, a key early warning sign for type 2 diabetes, metabolic syndrome, and other lifestyle related disorders. Joining us today is Dr. Snigda Panuganti, Consultant General Physician and Diabetologist at Pace Hospitals, Hyderabad, with extensive expertise in preventive medicine, metabolic health, and diabetes care. In this episode, Dr. Snigda guides us through an insightful discussion on the fasting blood insulin test. That includes what it is, why it is important, how it is performed, and how it helps in early detection of insulin resistance. Dr. Snigda Panuganti, thank you for joining us today at Pace Hospital's Hitech City. Let's start by understanding what is a fasting blood insulin test.
It's a simple blood test done after 8 to 12 hours of fasting, where it measures the amount of insulin in the blood. If the insulin levels are high, it indicates insulin resistance.
So doctor, what is insulin resistance?
Normally, insulin produced by the pancreas helps the cells to utilize the blood glucose. But when there is insulin resistance, these cells respond poorly to the insulin stimulus. So, pancreas produces more insulin to help maintain the blood glucose levels in the normal range. This is called compensatory hyperinsulinemia. This is the earliest sign of insulin resistance.
Dr. Snigda, why should one care about insulin levels if the blood sugar is normal?
Because blood sugar levels can be normal even if you have an underlying insulin resistance. Because insulin resistance develops like 10 years before the development of actual diabetes. So, to find out insulin resistance early at an early stage where we can prevent development of diabetes by doing lifestyle changes, we have to do fasting insulin levels.
Can you explain what does the fasting blood insulin test actually measure in the body?
It measures the blood insulin concentration. So, insulin is a hormone produced by pancreas, help cells like liver, fat tissue, and skeletal muscle utilize the blood glucose levels. By testing fasting insulin level, we find out the early insulin resistance.
Is the fasting insulin test part of routine health checkups?
No, usually most health checkups focus on blood glucose and HbA1c. But in patients who have risk factors like obesity, fatty liver, PCOS, and family history of diabetes, if you measure the fasting insulin levels, you can identify the insulin resistance years before the actual development of diabetes, where lifestyle measures can prevent or reduce the risk of development of diabetes.
So doctor, can stress or poor sleep affect fasting insulin test results?
Yes, stress hormones like cortisol and poor sleep can increase the insulin resistance. So this test should ideally be done in a well-rested state and not during the acute stress periods.
Dr. Snigda, how does fasting insulin test show early insulin resistance?
When the cells respond poorly to the insulin stimulus, pancreas try to produce more insulin to maintain the normal blood sugar levels. This is called insulin resistance. So, during this period, if we check the fasting insulin test, the levels will be usually elevated, which indicates an early sign of insulin resistance.
So doctor, can fasting insulin test helps to detect pre-diabetes before blood sugar rises?
Yes, pre-diabetes is when the sugars have already raised, like fasting blood sugars are between 100 to 126 mg per deciliter, and at this stage there is already insulin resistance. So when we check blood fasting insulin test at this stage, insulin can be high, indicating there is high insulin resistance. Even at this stage, if we find that the patient has insulin resistance, by doing intensive lifestyle modifications like exercise, diet changes, we can still bring the sugars down and control the insulin resistance.
Could you explain what is considered a healthy fasting insulin range?
The fasting insulin test, the normal range is between 3 to 5 micro international units per liter. If it is above this, we call as hyperinsulinemia, which indicates it's a first sign of insulin resistance.
Dr. Snigda, what does a high fasting insulin result mean?
It means that the body is already trying to compensate by producing more insulin to maintain the normal blood sugar levels. It is an indicator of insulin resistance.
What does a low fasting insulin result mean?
In individuals who have low BMI, they can have lower levels. That is normal for them. But in advanced type 2 diabetes who are on multiple medications, in them the low levels indicate that pancreas has exhausted and it is producing very less amount of insulin. And in certain cases like type 1 diabetes, it's an autoimmune disease where the pancreas is damaged. In that case, we can find low insulin levels.
So doctor, when can we improve insulin sensitivity with diet changes?
Yes, diet plays a major role by including whole grains like brown rice, millets, and reducing the polished rice, including a lot of vegetables, fruits, and consuming low glycemic index food, including lentils and beans and healthy fats like nuts. We can control the insulin sensitivity because these low glycemic foods will reduce the insulin demand.
Dr. Snigda, can physical activity improve insulin sensitivity?
Yes, physical activity is very important to improve the insulin sensitivity. When we are exercising, muscle can take up the glucose even without the presence of insulin. So, aerobic activity like cycling, brisk walking, and resistant training like body weight exercises, when these both are done together, it will show maximum results. And even like 9% of body weight loss can give very good results.
So doctor, how often should we check fasting insulin levels?
If a person has risk factors like obesity, fatty liver, PCOS, family history of diabetes, do it once, fasting insulin test, along with the glucose and HbA1c levels. If it is within normal range, you can do it every 2 to 3 years. But if it is abnormal, do the lifestyle interventions for 3 to 6 months and recheck it to see the improvement.
Is insulin resistance reversible if identified early?
Yes, insulin resistance is reversible, especially with lifestyle changes like regular exercise, dietary changes, good sleep, and stress reduction. Insulin resistance can be reduced or completely reversible.
Dr. Snigda, what happens if there is a high insulin for a long period of time?
If there is insulin resistance going on for longer duration, like for 10 years or more, people can end up developing diabetes, hypertension, high cholesterol levels, fatty liver, and cardiovascular risk will be increased, which will increase the risk of coronary artery disease.
Why does high insulin causes weight gain and belly fat?
Because insulin is a fat storage hormone. When there is high insulin for long duration of time, it will promote fat generation and also reduces the breakdown of fat. And the fat will be deposited mostly around your belly area. And it becomes harder to lose the belly fat as we age because of increased insulin resistance.
Can high insulin levels cause cancer?
High insulin is not directly linked to cancer development, but chronically highly elevated insulin can increase the risk of development of certain cancers like breast cancer, colon cancer, and pancreatic cancer.
So doctor, one final question. Can high insulin levels increase the risk of heart disease?
Yes, high insulin levels for long period of time increases the insulin resistance, which will increase the risk of developing high cholesterol level, developing hypertension, diabetes, which are all the risk factors for the development of cardiovascular disease like coronary artery disease. So in summary, fasting insulin test is a powerful early marker. If caught early with lifestyle changes, insulin resistance can be reversible before the development of diabetes or heart disease.
Thank you, Dr. Snigda Panuganti, for sharing crucial information regarding fasting insulin test. We hope this episode has provided valuable insights for our listeners. The fasting blood insulin test may seem like a simple lab investigation, but it plays a crucial role in detecting insulin resistance early, long before diabetes or metabolic complications develop. If you have a concerns about your insulin levels, blood sugar, or overall metabolic health, don't hesitate to consult a general physician or diabetologist. Early testing, timely lifestyle changes, and preventive care can make a world of difference. Thank you for tuning into Pace Hospital's podcast. We'll be back soon with another informative episode to help you to stay proactive about your health. Until then, eat mindfully, stay active, and keep your metabolism balanced. Thank you.